want to welcome everyone here this morning. I'm Colin Murray. I'm the Executive Director with Dane Buy Local. Thank you for joining us today. Usually you do announcements at the beginning, but we're going to rearrange things a little bit here so we can accommodate some speakers. So our programming is provided by Peggy Gunderson from Strategic Brand Marketing. And take it away, Peggy.
Good morning, everyone. So happy to see everyone. We were just talking about warm temps and so much good news to get at today. So I'm excited and grateful that everyone is here. I'm just looking for Doug from Public Health. Is he on?
He's just joined.
Oh, fantastic. So so you know the lineup today, we have Bonnie Koenig, our great friend from Public Health, and she has invited Doug. Help me with his last name, if you would, Bonnie.
Doug Bagley, and he is
Bagley,
our operations chief for our Instant Command Center for COVID-19. He's also my supervisor, and he is of environmental health.
Well, Doug, since that's the case, you should know we love Bonnie to death. She's been a wonderful resource and a tremendous tool for us. We are so grateful. And I know we only have 5 minutes with you, so want to just jump right into it. You are in charge of emergency response for COVID-19. Specifically, now we're moving on to vaccines. What can you tell us as an overview? And then particularly one question we're getting a lot is, can we mandate employees to get vaccinated?
Sure. Yeah, just a quick overview. We, I think, are at the cusp of a great vaccine supply inventory increase in the next few weeks here. As you probably have heard, we got close to 12,000 doses for our educators and our childcare populations. We also have the federal retail pharmacy program going on right now. So a lot of people are getting vaccines at Walgreens, different Walgreens or Pick and Saves throughout Dane County. So that's pretty awesome. And we're finding a lot of people are getting vaccinated there. So what that does to us, that leaves us extra vaccine that we're not having to use on our educators and childcare, that we can be moving forward and getting into some of the other groups in 1B. And I anticipate that we can be done and through 1B by the end of March. And I also think that by the end of March, our supply will be adequate, that we will not have we will not need to be rationing or going by groups at that point in time. I have a feeling, and I think that it's going to come true in April, that we'll have vaccine supply for everybody. So I don't think we're going to have to necessarily start going through the 1C group. It may just be everybody is eligible at this point in time. Let's go forward because we have enough vaccine for everybody. I'm really hopeful, and I really think that's where we're heading right now. As each week it's going up by 15-20%, and as we get Johnson & Johnson back, you know, they gave us a bunch up front. There's going to be like a 2-week gap, and then Johnson & Johnson is going to flood the market, as well as the Pfizer and Moderna. And that's where we're at, like that 2-3 weeks. That's why I'm just saying in April, I think that we're going to open up much wider for probably, hopefully, most of the general population. So that's where we're at there. It's an exciting time. We're really happy with what we're doing at the AEC. What our healthcare partners are doing, they're carrying a large load here and doing a lot of vaccinations, as well as us, as well as Walgreens. So there's a ton of places now, and it's getting to be more and more places that you can get an appointment and get a vaccine. Mandating vaccines is perfectly within a employer's right to mandate a vaccine. That has been run through our attorneys a couple times, and that is within your right as an employer to mandate a vaccine. I know that there are some people that are not mandating at this point in time because it's still under an emergency use authorization. And some people are waiting until it's no longer under that authorization before they would mandate it for their employees. But really, it's completely up to you. if you want to mandate or not the vaccine. I hope that with the education and the work that we're doing out there, it really wouldn't be necessary to mandate, that we would convince enough people or provide the information to enough people that they are making an informed decision and vaccinating themselves. And that's where we would like to go. Because I think that if you do have the information readily available and people are reading it and understanding it, that there really won't be the hesitancy to get the vaccine. And I think we're seeing right now, as we get more and more vaccine out to people, that hesitancy is going down, down, down. There were some people that were probably just waiting, wait and see. And now we're past that wait and see. Some more people hopefully are coming on board and getting that the vaccination. I know we'll be watching the numbers closely, and hopefully they continue to increase. And like I said, by April, if we're opening everything up, that we'll see all kinds of people coming in for a vaccination, and we can put this pandemic behind us.
Awesome news. Very exciting. I know you have to run, but I do have one quick question because we
Sure.
hear it all the time. In terms of effectiveness between Pfizer, Moderna, Johnson & Johnson, I know there's different rates of coverage. But I also believe that Dr. Fauci is saying, take the first one you can get. Is that your position as well?
Absolutely. There is some differences, but I think the differences are getting a little bit smaller all the time as more information comes in. I know initially they were saying like 75% effective. When you look at it over 28 days, that bumps up to almost like 85% effective. So if you're thinking of 85 versus the 95, it's really kind of getting to be pretty much the same effectiveness with the vaccine. So people should not be waiting to choose a vaccine one way or the other. They should get the vaccine that is available to them. And the other nice thing about the Johnson & Johnson is that it is just one dose. So once you get that initial vaccine, you're done. You don't have to come back 3 weeks or 4 weeks later for that second dose. So it's makes it much more convenient for people just to get the one dose with Johnson & Johnson. I truly agree with Dr. Fauci that really it's take whatever you can get, and then looking at the numbers and everything, Johnson & Johnson really is pretty much just as effective as the Pfizer or the Moderna, and wouldn't I would get Johnson & Johnson, no questions asked.
No problem.
For
Awesome.
that protection.
Good. Yeah. And this is great news because we have been, doing the September, October, we're going to get there. And now, I mean, by, May, June, that means so much to our small businesses, to our events. It opens everything wide up. Thank you for all you're doing. I know you have to hop off. We are so grateful that you spent time with us, and we appreciate your information.
No problem. Thank you very much.
Thanks,
I appreciate it as well.
And again, we love Bonnie.
I do too.
Thanks. Take care.
Bye-bye.
Speaking of Bonnie, there she is. We do have a few more things that we want to cover. We're going to get to our good friend, Deb Archer, who's here with us. We're going to talk a little bit. I mean, gosh, don't you all just feel better after hearing all those numbers? Everybody thumbs up. I mean, yeah. This is great news. And Bonnie, thank you for arranging for Doug to be here this morning. We're so grateful to you. So let's then talk about where we go from here. I think the nice thing about this is there's no more of this rounds 1B, 1C, trying to get it where you can kind of thing. It sounds like in the 2 weeks, patients for 2 more weeks and floodgates will open and we're all going to be eligible. Is that correct?
That is. And, we were just talking today, Doug and I, about how, in this whole emergency response, we've kind of experienced the opposite of what's happening right now. It seems like there was always something that we couldn't predict that would create a detour and set us back. But we're at this really wonderful hour and time in our emergency response where the stars really are aligning and things are going well. And if things continue to go well, this is better than we anticipated, and really exciting news for all of us.
It's outstanding. And we don't want to lose sight of the fact, though, that you know, while we're all excited, we see the light at the end of the tunnel, we can start planning our events again, opening up wider, we still are where we're at. It's still masking, washing hands, social distancing. And I would imagine, right? So everybody's going to get vaccines, but if it's a Moderna or Pfizer and it's 2 shots, you really have about a 30-day window. You get the first dose, another 20 some days, the second dose. So, you know, we still have, you know, we're not there. We still have a little ways to go, and we still have to kind of maintain those basics, because you can still get COVID, even though we're all excited about it. You still want to stay safe.
Absolutely. And, you know, the word we use is we're cautiously optimistic here at Public Health. And we don't want to forget our best source control, which is distancing and masking. And we'll likely see that throughout the reopening orders. You know, we're excited to begin reopening more, but you see that we still have all the same masking requirements, all the same distancing requirements, because that's really the best thing that we can do to prevent the spread of COVID-19. And then, of course, reducing the amount of people that are gathering. So that still exists in our reopening orders. You'll see it throughout. But as we can reopen, as more people get vaccinated and the hospitalizations go down, we will continue to have this gradual phased in approach to reopening.
So, not to be Debbie Downer, because I'm thrilled with this news. It's the best thing we could hope for, right? There are some people who choose not to get vaccinated for a multitude of reasons, and totally their right to make that decision. But as we move forward and we go out over the next couple of months or years, my understanding is there may be times in larger groups when a mask is still not a bad choice. Even though you've been vaccinated and the majority of the population, there are still folks that for whatever reason are not. What are you hearing? Anything? I mean, I can't imagine it'll be mandatory, but I would imagine it's not a bad idea.
Yeah, certainly when the emergency orders are over, it's not going to be mandated anymore when those are lifted. However, I do think there is going to be a subset of our community, and I probably will be one of them. When I'm in certain settings, I may choose to wear a face covering because it has proven to be very effective preventing the spread of COVID-19 and other communicable diseases as well.
All right. Yeah, I agree. So where we're at right now, we still have Order 14 in place. And I think Brittany was going to join us. Is that right?
That is correct. Brittany is here. She's from our data team, and she is going to share a little bit about our new Forward Dane plan. So it has been updated with new metrics. Really want to share that out with all of you on the call today because there have been significant changes, again, with, you know, the new optimism that we have. So I think Brittany's ready to share some of that.
Yes. Can people see the screen?
We can.
Okay.
And good morning. Thanks for being here.
Good morning. Yeah, as Bonnie said, I'm Brittany. I'm part of our data team, and I'm outside of COVID, a data analyst with PHMDC. So I just have a few slides where I'll kind of go through just briefly where we've been and now what has changed with the new orders and with our new plan. So we originally developed Forward Dane back in late spring of last year. We kind of used the best information that was available to us at the time. We've of course since learned a lot more. But originally it was kind of this phased reopening plan. We developed this during our safer at home orders. And then we had these phases that we hoped to move through as we met the thresholds we set for 9 different metrics that we came up with, which we developed based on kind of a hodgepodge of resources that, you know, it was from the CDC, from the WHO, from other health departments, from our state health department, just trying to come up with the best way to ensure a safe reopening. So you might be familiar with these metrics. We had 9 metrics that we have been reporting on now weekly for almost a year. And we had green, yellow, and red thresholds for each of these metrics. So some have worked out well. Some were not informative. Some, the thresholds could be problematic. I'll talk about a couple of those, but the metrics that we decided not to keep are the number of tests conducted, because we're kind of rolling that into the percent positive metric. The testing for healthcare workers, this was kind of just monitoring infections among healthcare workers and that trend. We've been seeing very, very few lately. Of course, they were first eligible for the vaccine. Some of these hospital metrics, like patients being able to be treated without crisis care, those were developed at the state level and ended up being discontinued. Hospital metrics were always challenging. We, even during our highest caseload, our hospitals were saying they weren't having to use crisis care, but they were still strained. So some of these metrics just ended up not being that informative. And our COVID-like symptoms, that was kind of supposed to be an early warning sign of potential case surges. But since we've really just had a pretty robust testing available to our community because of the Alliant Energy Center and other testing sites, we've been able to track cases and surges pretty well. So that ended up not being very predictive of surges. So we, on last Thursday, released a sort of year in review data snapshot. If you haven't seen that, check that out on our website. We kind of went through these metrics and why we're discontinuing some of them. And so this is where we've been for cases and percent positivity ever since we started monitoring these. So cases was basically always red ever since we had our first sort of small reopening last summer. And we figured out that the thresholds thing there was kind of problematic. We knew that once we were at this, right before it turned red here, we were kind of creeping up in cases, but our metrics really only took thresholds into consideration and not the trajectory of cases. And so we really need to take both of those into account, kind of see the trend in the level. And we just really didn't know at the time what was going to be a crisis level of cases or an unmanageable load. We obviously had very few at the time and also very little testing. So it was hard to determine kind of where those levels should be. And with percent positivity, it was a pretty good indicator of when we were experiencing high caseloads and when there was probably more COVID in the community than we knew about through our testing. So we will be keeping percent positivity and of course still monitoring caseloads, but we're getting rid of those thresholds. This is our testing. It's pretty much always been green. Like I said, we've had a good amount of testing. It's only been increasing. A lot of that recently is because of UW is doing a ton of testing of their students and staff. So we won't be monitoring that as closely anymore. We'll just have that as part of our percent positivity. Our lab timeliness and contact tracing, where this is the percent of people that were contacted within 48 hours of when their positive test was collected. This was pretty good at telling us when we were, either we were overwhelmed from a public health contact tracing perspective or labs were overwhelmed with the amount of tests coming in. You can see it was at a very low point during our surge in cases. So we will still be monitoring this. And then we had a community spread metric that was the percent of people who didn't know where they got COVID. And this ended up not being that informative. Some of it is just data quality, but it never really changed all that much and it didn't really align with when we were seeing high caseloads. So we're discontinuing that. And you can read all about these, like I said, in our year in review that we released last Thursday. And so our new measures, we have a really heavy focus on vaccination. That's really where we want to see a lot of movement, which we have been. I think we're already at more than 1 in 5 people in Dane County have had at least 1 dose of vaccine, which is great. So we're measuring the percent that are fully vaccinated. Up until now, that's been 2 doses, but as Johnson & Johnson rolls out this week, that'll just be that single dose. The percent that is partially vaccinated, the percent of people age 65 plus that are at least partially vaccinated, which we're already over 70%, which is awesome. And those are our 3 like main measures here. The 65 plus, because as we know, those are the most vulnerable people to COVID. I think almost 90% of our deaths have been of people age 65 plus. So now that we have so many people in that group vaccinated, we really expect to continue to see few hospitalizations and deaths. Our hospitalizations have been decreasing for a while now, as have our deaths. And then we have a few of these process measures that we'll also be monitoring. Immunity percent of Dane County that is fully vaccinated, plus the percent that have immunity from a past infection. We don't have a great way to measure this right now, but we can estimate and kind of see where we might be in terms of herd immunity. The rate of vaccination, how many doses we're giving each day. Equity considerations, looking at people of color who have been vaccinated, and also looking at people, we put rural populations here, but it's right now we're kind of looking at people outside of Madison versus in Madison and making sure that there's that not a gap in access between that. And then variants, we're doing as much monitoring as we can of variants in the community, since some of those might be harder to control with vaccines. So keeping a close eye on that. And then our epi measures, all of these we have been monitoring this whole time, but they haven't really been a part of our plan, other than we have cases and tests or percent positivity. And our contact tracing, those are all continuing, but we'll include a 2-week trend for cases, which we show on our dashboard. Sorry about the train. We'll have inpatient hospitalizations with a 2-week trend, which is also on our dashboard. For deaths, number of people who died within a 1-month trend, since that tends to be, we find out about those a little later. It takes some time to confirm those. And then our infection rate R for transmission dynamics. So we'll have a new snapshot out this Thursday that reports on our new metrics and information about them, and basically everything I talked about is in the plan that we released last week.
Peggy, you are muted. Did you hear us, Peggy? You're muted. Oh, you're stuck. She's stuck. Okay. Well, thank you for that information. We appreciate you covering that. Bonnie, did you have any other material that you wanted to cover?
I guess I would just want to review what the new order requirements will be starting this Wednesday. So this Wednesday, we are moving forward in a big way in our reopening orders. And just to summarize what that's going to look like, restaurants are now going to be able to open at 50% capacity. And bars and taverns can now open, and they are going to be open at 25% capacity. Both bars, restaurants will have to abide by the same requirements as restaurants, where everyone needs to be seated. But the big change for restaurants that is that now when people are seated, you can sit with other people from other households or living units. However, you have to be distanced 6 feet from them at all times. And just a reminder, in these spaces, the bars, restaurants, and taverns, you are to be wearing a face covering at all times unless you are actively eating or drinking. And I have seen on some of my compliance checks where it says when you sit at a table, you can take off your mask. That's not true. Our orders are clear, is only when you're actively eating or drinking, and then the mask would go back on. Some other changes in our orders are the increase in gathering numbers. And this is really exciting for those types of business sectors that rely upon planned events for their business, like weddings or entertainment industry. The gathering numbers now are 150 indoors if you are eating and drinking. It goes up to 350 indoors on Wednesday if you're not eating and drinking indoors. And outdoors in all situations is 500 people. And really what we want to show here is that outdoors is still the least risky space for us to be in together. And so we really want to promote outdoors as we go through our reopening phases. So I'm happy to take any questions in regards to the new order requirements to help with any clarity that you may have or need.
I was able to unmute and I do have one, and I think it came out with order 14 was, and I don't know that it's part of the order or merely a suggestion, but the type of mask that you're using. You know, I see a lot of, so we're having a lot of construction done. I see a lot of construction people with, you know, the I don't know, the turtle thing that they just pull up kind of thing. And I think I saw that that is not a very effective means to protect yourself. And I can't remember what the technical term is for those, alligators or?
Yeah, gaiters, or
Gaiters.
bandanas, they're no longer allowed. You need to have a mask that's tight fitting, goes around your ears. We are recommending double masking. It's a very effective method. If you have a surgical mask and then a cloth mask, to wear your surgical mask and then the cloth mask over really is a significantly changes and makes that more effective. So we're recommending that, but what's required in the orders now is that you have a tight fitting face covering. It needs to be 2-ply, meaning 2 pieces of cloth, or the surgical masks that have the 2-ply of fabric. And it can no longer be the gaiters or the scarves or bandanas. So that's the update on that. And that was from our last orders, and it continues forward in these orders.
Is that something we've learned, the double masking, as we've gone through this? You know, and I'm surprised it took us kind of this long to get to that point, but I see a lot more people doing a surgical mask with another mask over it. I feel like that's something new, or have I missed it?
No, it is new. It came from a scientific research project that occurred, and I can send you that link to that report. It's actually very well written, and they looked at different types of masks and different ways to wear masks. You know, how you whether it's loose fitting or you twist the corners around your ears, or double mask. And it was from that research that we were able to start, sharing out with everybody the importance of double masking and how that makes it more effective. It's also more readily available to all in our community. Most in our community have those types of masks available, and so it's more accessible and all of us can be participating in that. But I'll send that link out to that research project, and I'll also send the verbiage that we have in our orders. It's very specific about what masks are allowed and what is not allowed, so that all of you can have the best information.
And I think that's really good for us to have for our businesses, again, keeping our staff, ourselves, our staff, our customers safe. So we would appreciate that. We'll definitely send that information on. As always, you've just been amazing. And now, we're coming, hopefully kind of starting to come out of this and a little bit of celebration. But, we've certainly had some crazy times over these last number of months. And we know we have a few more months to go. But again, our thanks to you and your team, everybody at Public Health, for sharing this valuable information with us. We're so grateful.
Well, I'm grateful for all of you giving us the opportunity to share broadly with everyone in our community, especially the local businesses. So thank you.
Appreciate it.
The information from Brian this morning, is that like breaking news? Were we one of the first places to hear this information?
You mean Doug or?
Doug. Mm-hmm.
I'm sorry.
Doug, I would say that anything that you hear from Doug today is the latest and greatest. Yes.
Yay, Doug.
Yes. So we were looking for an opportunity to share broadly, and we're just so grateful that you allowed him to come on and share. So absolutely, yes.
Sure. Yeah, we did have a number of people that actually missed the announcement. So would you mind just repeating that for the ones that came late?
Oh, gosh, now there's so much that he said, the announcement, now I'm having a blank, the announcement of,
Specifically about vaccines being available April 1st.
yes, we are very hopeful that we're going to have a lot of vaccines available April 1st, such that we may not even need to go to the next tier, that it would just be eligibility for all. And the other message that Doug was saying is that it's up to each business to determine whether or not they're going to mandate or require for their employees to require them to be vaccinated. But it is in your legal right as a business owner to mandate that for your employees. So I think those were the two big updates, and a lot of hope and optimism around the amount of vaccine that we have coming and the impact that it's having on our community.
Yeah, and we do record this. We will have that up for you. We'll put it up on Facebook. But again, we've got Deb Archer we want to get to, but again, Bonnie and Brittany, thank you all so much for being here as always. We will continue to stay in touch as this progresses. Good news all the way around. Thanks again. So we are excited. Boy, does this change everything, right? This is just probably the best possible news we could come. And so, you know, one of Madison's biggest cheerleaders is with us this morning. Good morning, Deb Archer.
Good morning. Good
As
morning. Good
everyone knows-
morning.
Yeah, what great news. As everyone knows, Deb is former president over at Destination Madison, and I am sure with events, this is music to the event community's ears.
Yeah, I've been following things. I'm down in Arizona. I've been following I read the news every day, and I hear from people, and I still sit on the Governor's Council on Tourism, which I actually just talked to their office last week because I wanted to make sure they were tuned in on the World Dairy news and really trying to keep World Dairy. I mean, this is what literally people we've all been praying for, all of you, all the businesses that are relying on whatever, if it's leisure business, day trippers, overnights, groups. It's sort of it's exactly 1 year ago this week that we all know everything shut down on Friday the 13th. And so it's really remarkable that we've all survived. Well, it's not everyone has survived. There have certainly been businesses, but this news helps all of us get re-energized and focused and doing everything we can to help our businesses and get people back to work.
Yeah. And, you know, the last time that we spoke, we were talking about, you know, just being on the safe side and the conservative side, like it'll be September or October. And so, you know, now some of these big events that happen in Madison take so many months to plan, quite frankly, years. How does this change the game with the news that we just heard? How do you speed that up, or don't you? Do you just pick up and say, okay, this is the first event we can do and move along from there?
Well, I would hope that it would accelerate the conversations with event planners. I mentioned, I talked to the governor's office last week. The deputy secretary of DOA is a gentleman by the name of Chris Patton. Mm-hmm. And Chris was on our board at Destination Madison because he used to work at Epic, and he was over their travel and their user groups, which of course we host April events and August events. And I asked Chris, I said, you know, what is it? Because we were talking about World Dairy. What's the threshold, you know, in terms of planning? Because you can't decide in September that you're holding a World Dairy in October. And so I'm incredibly helpful that this information, that particularly this vaccination information, that this is going to accelerate, will really push, bring more close to today, the timing when group event planners can feel comfortable about saying, we can hold our events. And what that threshold is, I don't know. I don't want to even pretend to know, but I'm sure World Dairy's announcement last week was because we need to know now. And so if World Dairy can get this information now, they can probably start feeling comfortable that things will be ready to go in Madison in October. So I think the vaccination information will accelerate conversations and energize people to move.
Yeah, and I think, as always, there's that partnership with public health, as Bonnie was just saying, we're still at some limitations here because it's going to take us time for everybody to get the first vaccination, then 30 days. So we do have some time, which may be great for planning purposes, but maybe there's a way that they can forecast how many they can do and what that time frame looks like. But it certainly speeds things up. I mean, I'm thinking UW football and what that does to our economy. What was the number, if you recall? What is the impact that a home football game has in Madison? Was it 16 million? Does that sound right?
I was going to say 14 million, but
Okay.
it's yes.
Close enough.
In that neighborhood.
Better than zero, right?
Yes. Well, I think, the cascade that happened a year ago was we're not hosting boys basketball. And that was always sort of the WIA events in February and March were sort of the beginning of that big group season. And so, if we can start seeing things in June and July, I will know that in the travel industry, I know several people that are attending events this month live. They're doing hybrid events, but they are at US Travel is holding its board meeting in Tampa, that there are events, and I'm in Phoenix and they are starting to host events here. They're pretty much opening up. I belong to a health club here. It's a mask mandate, but things are very open and people are willing to travel. There's a hotel next to our condo complex. I will tell you, their hotels in Phoenix are running 80% occupancy. People are ready to travel and particularly drive travel, which Madison and Dane County is a great market for drive travel because we're between Minneapolis, Chicago, the Quad Cities, Green Bay. Madison's in a really good place. And I know Destination Madison, if anybody follows Visit Madison's Instagram, doing a great job. Travel Wisconsin's doing a great job with outdoor recreation, but things like museums opening and the outdoor events, concerts, I sure Frank Productions and Mallards are, just ecstatic because these are the things that are as humans that we're all ready to do. And I think it's incredible news.
Even things like the zoo. I just saw they have their carousel back open. Not every seat is available, but they're doing a fundraiser where you can get for $100 you can get your kid or pet's head put on one of the stationary animals where you can't ride. But people have gotten creative and kudos to them. But now it looks like, again, as we move through this thing and vaccines become available, we'll be back at it here real shortly, which is just great news. The other thing that I wanted to talk to you about, you and I talk, frequently, and as always, I'm always impressed by no matter what's going on, good, bad, otherwise, you always have this great positive attitude, and you've always been, as I call you, Madison's greatest cheerleader. So we've gone through this pandemic and we have, it's going to take us time. I think on a federal level, they're saying at least 2 to 3 years before we get back economically. So we know that there's businesses hurting. We know that it's going to take us time to revamp on hotel stays and all these kinds of things. And one thing that has struck me as of late is, and of course, that's before this great news today, but one thing that has struck me as of late is business owners and community leaders and other folks, particularly in the downtown area, right? We just got done onboarding, which is a big deal. And, still this negativity. And we look, nothing's perfect. We know we have a long road to hoe here. But what would you say in terms of, a business owner that is maybe struggling, just waiting for these events and things to kind of get back to some sense of normalcy, knowing it'll take time? What's your best advice for staying positive and looking to the future and just trying to get up every day and make it happen?
Well, I was thinking about this, Peggy, when you asked me to come share some ideas. I think one of the things is make sure that, you are following those entities on social media and other ways that are pushing out positive messages, and share those messages. Try to absorb them yourself, but share them. Share the positive news that, say, Destination Madison is putting out about, what there is to see and do, and think about those things, because what you want to do is you need as a human to start absorb those. I always say that people will know whether you're genuine, if your head, your heart, and your mouth are all saying the same thing. So if you're negative, you can try to pretend to be positive, but really try to work on yourself and say that there is positive news. There is a huge light at the end of the tunnel. This isn't even a glimmer. I mean, for a while there were glimmers. This is a huge light. And so how do you take this information and for yourself, for the people you live with, for the people you work with, and share that, and then also try to curate that other positive information you're seeing others put out there, and couple that with your own. So if you're putting messages out about your businesses, incorporate some of that information that some of these other entities, Travel Wisconsin or Destination Madison or you, Peggy, that are sharing, or public health, incorporate those into your messaging, because it will build. It will literally build. And I can't honestly imagine some of what some of you have gone through. I can't. And so, to try to build on that and build your positive, being hopeful and being optimistic. And I think that's, I'm just a person that tries to rely on hope and not fear. And, if you're a person that sort of is more afraid, see if you can't move yourself to the more hopeful thing, and look for those entities that are really pushing out hopeful messages.
It's a great idea. I just made a note of that. I think we do that, and we have to continually do it because we don't all get up every day. It's not always sunshine and roses. A bill may be coming due that you're, struggling to pay in your business or whatever. Things happen, but by following what you're suggesting and just sharing this good news, you don't even have to say anything, just share it and move on. One of the things that I've always thought was great about the job that you did at Destination Madison is, look, Madison, Dane County, Wisconsin, for that matter, we have, just like people, we have our faults, right? But what you do is you try and find the good in everything. And I think that when we invite people into Wisconsin, into Madison, into the area that your business is at, it's kind of like inviting somebody to your home or a fun cocktail party or an event, right? And so if I say to you, hey, Deb, come on over, it's not going to be much fun and we don't have a lot going on, but come on over, right? What's the message? So I think that's a lot of what we're hearing. So everybody on this call, whether you realize it or not, in my opinion, is a community leader. You are a business leader. People see you, right? So words really matter with this. It's what you say. So even though you might be trying to be real, sometimes that can bite you in the fanny, because what people are hearing is, come on down, it's gonna be fun, right? Like you gotta shine the sunshine, I guess, on the positive we do have, right?
You find those nuggets of, that gold and those nuggets and that's what you really need to build on. I was excited to read in the chat, Monique Branch, who used to work at Destination Madison, who works for Expedia, noting that Expedia saw its best room night booking since March 13th on March 2nd. That is amazing news.
Wow. I didn't know that.
That means we are moving. We as people are moving, traveling.
That's awesome. Yes. And you can see that now with spring break coming up. I'm already hearing people heading to, I got my shots, I'm going to Florida or wherever they're going. But so, the other thing I was going to suggest too is when you're posting, right, is to find things that are going on. Like we were just talking about the zoo, right? It's a free zoo, which is really unique in the country, as I understand it. But find and I don't know if the Children's Museum is open yet, but my guess is they will be soon if they're not. But right, like if you don't have a lot of positive going on in your business, you can also be a cheerleader for the community.
Absolutely. And, it's things like, remember, you can ice skate at the Edgewater, even if it has nothing to do with your business, but again, to point out those things that there are for people to do. And I'm so excited that it's getting warmer in Madison, because it means, there might be more outdoor dining. I talked to somebody who had brunch in Madison a week ago, not this weekend, but the past weekend, and just had a fabulous time at the Settle Down. Just a great, great time. That's Again, no longer a glimmer, it's a light.
It's becoming a reality. You know, I'm curious what your thoughts might be on this discussion about the pedestrian mall in downtown Madison. To me, it really seems, you know, I was listening to Mike Vivier on a call talk about it and the possibilities, and, you know, it's going to take a little work. But what are your thoughts on providing that?
Well, I wrote a letter to the editor when that first started happening. What was it, a month ago? The conversation was sort of rising. I know it's complicated. There are delivery issues, there are emergency transportation issues, there are federal funding issues regarding State Street. What my hope is that due diligence is done to see if some level of more pedestrian activity can happen on State Street, whether it's permanent or every other day. I have been to those places other people are referring. I haven't been to Burlington, but my brother went to school in Boulder. Iowa City has a wonderful pedestrian mall. It's amazing. I mean, we all know what State Street looks like when people are walking on it. When Streetery took place last year, you know, King Street really, really, really rose up. It was a little harder for State Street, but I have to believe that creating that sort of human energy makes a big difference in how we all feel about our own city, but how people will come and it will thrive. I think it's really important. And again, we all know it's very complicated, but I just really am hopeful the city will do complete due diligence to find out, could this be done? Because I think most people think it's probably a pretty darn good idea. So how could it be done? Can it and how?
And you're right, there's a lot to consider. How will people get around from the top of State? So there's an emergency vehicles, all of that. If you're interested, you can Google I think it's Pearl Street, right, in Boulder, Colorado. That is kind of the example. And I think Mike Vivier's brother, I believe, lives out there. So he has seen this firsthand. The Streetery program, as successful as it's been, is very similar to this on a permanent level. And so it's not far from what we already know has been successful. So if you're interested, just Google Pearl Street in Boulder, Colorado, and you'll see some photos of what they're doing. That's not to say this would be the same, but I think it's a very exciting opportunity.
Well, absolutely. And I think any people that have been fortunate to be in Europe, like my daughter went to school in Copenhagen and we went through there. I can't ever say the word right, STROGET, Stroget or whatever it is, complete pedestrian retail center that was just astounding to us. We were just amazed.
Yes. And there's been some discussion, right? I think there's, 40% of the businesses downtown are closed, but this may present an opportunity, to be honest. So, if you're kind of thinking you might want to branch out with a new location, you might want to just get some details on that program and where this is going, because there will be storefronts. And quite frankly, I think they're going to be incredibly valuable if this does go through. So anyway, just a little bit on that. We've got some announcements to get to, but as always, Deb, thank you for taking the time is your granddaughter still down there with you?
No, they went home, but I'm delighted that you invited me, and I remain just a fervent lover of Madison and Dane County.
Well, Madison loves you right back. Thank you again for your time. We're greatly appreciate it. Before we get to other announcements, I do want to just kind of go through this new American Relief Act and just some things that pertain to small businesses. As you all know, the House is voting on this tomorrow, but the breakdown for small businesses is about $7.25 billion with a B for another round of PPP, which is great news. $15 billion, again with a B, for economic injury disaster relief, and that's the EIDL loan through the SBA that we're talking about. It does provide for an extension of employee retention credit credit, which is a refundable credit that's equal to as much as $7,000 per employee per quarter, the last half of the year. So that's a big one we want to keep our eyes on. 28.6 billion in grants for food services businesses. Again, just trying to get them over that hump. Now, this is on top of, the current PPP that we're in with just a week left for small businesses. The one that I'm particularly interested in is 1.25 billion for what we're calling the shuttered venue operators. It's SVOGs for short, but it's for businesses that, again, a wedding venue, a Bree Stevens Field, a Mallard, those types of events that are dependent on, or venues that are dependent on events. It could also be event operators. So if you have, I'm just trying to think of an example, a limo company might be one. I'm drawing a blank, but anybody, photographer, perhaps a videographer, companies that specialize in providing services to events would be included in that. So again, everything could change before they vote tomorrow. There could still be some tweaks, but it does go back to the House, and it is expected to pass. And if it does, it'll go over, I believe, to the president's desk, and he'll sign it. But again, all of this still fluid, but that's kind of the way it shakes out. Now, we thought, because we weren't sure of the vaccine situation, it was, or still is being discussed, that this is the American Relief Act, that there would be the American Rescue Act that would follow it with more PPP, et cetera. I don't know where that stands since now we have this news about the vaccine, but they're already working on those details while this one is still moving through the House. So lots of good news on the webinar this morning, Colin.
Yeah, no kidding. No kidding. Yeah, just a couple of other announcements that I have. One related to what you were just talking about here. Another chunk of change that's in this relief package is for state and local government. And that's where our funding comes from for the grant program. It does appear that that's going to be in there. So keep an eye out for that. As soon as we hear anything, we'll put information out there if there is a third round of grant program dollars available for small businesses in Dane County. So that's how it all trickles down to us, right? So if you are in the round 2 application, if you've completed an application, just be aware that we are working on getting notices out. Those will start flowing this week. It'll take probably a couple of weeks for us to get all of those notices out there as well. But we are getting close on the awards for round 2 grant dollars. So be aware of that. Just a couple of other things coming up here, just real briefly. Tomorrow, we have a breakfast for Dane by Local at 8 o'clock. You can sign up on our website or Facebook. You can find the link there. It is a Zoom event, just like this today. And our main speaker will be talking about preparing for beyond the pandemic. What comes after all of this, and how we can get prepared for that as small businesses. It'll actually be a 2-part series that'll take place there. So you'll want to join us for the first part tomorrow with Heather if she presents that information. And then finally, we've got the Coffee Fest, virtual Coffee Fest event coming up March 25th. So if you enjoy coffee, this is an event for you. So March 25th, it'll be virtual here on Zoom. It's starting at 7:30, running till about 9:15 in the morning, and it is guaranteed to be fun. We have drag queen coming and joining us. She'll be the host. Her name's Ruthie. Very fun. You'll have a blast. Learn all sorts of good things about coffee in Madison, and you can get a little goodie bag. The list goes on and on of things to enjoy there. So go on our website. You can sign up for that as well. So I think that about does it for me. Peggy, do you have any other announcements?
I think we have so much good news. What a great way to start a week, right?
Yeah, no kidding, no kidding. So we do have recording of this material. Jason, who's on this call now, will get that posted so that you can share that information. If you want to listen to it again, send it to your friends, all sorts of good stuff. Have a great week, everyone. We'll see you shortly. Thanks for joining us today.